Hi,
Hi.
good afternoon. My name is Asuji and I'll be your provider today. How are you doing?
I'm doing all right.
Good. How is the weather?
Uh, it's better now.
Okay, good. Thank God. All right. So please tell me your name and date of birth.
That's Michelle Erickson, 8985.
Thank you. So what brings you to the clinic today?
I'm having some lower back pain that's going into my hips and down my legs.
Oh, okay. I'm sorry to hear that. Can you tell me exactly the location of the pain?
It's on the right side, lower back.
Okay. All right. So how long have you had this pain?
Just about 3 days.
Okay, good. It's good that you came into the clinic today. All right. So can you tell me how the pain feels?
Sometimes it's sharp, but it's mostly like a dull ache that goes into my hips.
Okay. All right. So what makes the pain worse?
Sleeping definitely makes it worse.
Okay. And what makes it better?
Hot baths, kind of just relaxing.
Okay, good. All right. So have you taken any medications?
Just Tylenol.
Okay, Tylenol. All right. So on a scale of 1 to 10, 10 being the highest, can you rate the pain?
Today it's about a 4. Normally, on a bad day, it's about a 6.
Okay. All right. Thank you. All right. So my assistant had taken all your vital signs. Everything is good. But I will say you watch your blood pressure, okay? Especially when you're standing up. We've taken the preliminaries. Everything is okay. So right now I'm going to go ahead and do a head-to-toe assessment.
Okay.
Okay. So we're going to make sure that everything is fine and everything is working good. Okay.
All right.
All right. Okay. So I've washed my hands. Okay, and I put on my gloves. So I'm gonna look at the head. Okay, and if you can turn your head a little bit. All right. So the head is normal and non-cephalic and straight lines intact. Okay. So right now I'm going to use this is a Snellen chart, and I'm going to assess the eyes. So I'm going to ask you, what number can you read?
The last line, the 2020 LTFPH.
Okay, perfect. Thank you. All right, the next thing I'm going to do is I am going to assess your reflexes. This is an ophthalmoscope, and I'm going to use it and look into your eyes, okay? All right, so, okay, all right, thank you. There are no drainage found. The eyes is reactive to light and accommodation. Okay, so the next thing I'm going to do, I am going to check for your peripheral vision. So I'm going to tell you, please tell me how many fingers I have here.
2, 3, 4, 3.
Perfect. All right. So the peripheral vision is intact and normal. There are no abnormalities found. All right. The next thing I'm going to do is I am going to check. This is an otoscope. I am going to use it and look into your ears bilaterally. All right. So I am going to look over here. All right. Sorry. And over here. Okay, there are no drainage found. The ears are intact bilaterally. Okay, the next thing I'm going to do, I am going to do a sound check. So I am going to whisper something in your ears and you tell me what I whispered, okay?
Right.
Please look straight. Okay.
The weather is better.
Thank you.
The weather is better.
All right, thank you. Ear sounds are intact. There are no abnormalities noted. All right, the next thing I'm going to do, this is a tuning fork. I am going to place it on your head and you tell me if you hear the sounds, okay? Do you hear any sounds?
Yeah.
Okay. Which ears? Both
Both
ears?
of them.
Both ears? Perfect. The hearing is intact for the Weber test. No abnormalities noted. All right, so we are going to proceed. And the next thing I'm going to do, I'm going to check for your, I'm going to check the mucosa for any sores. I'm going to have you open your mouth for me and say ah. Okay. All right, and one more. I am going to check for any sores. So I am going to have you open your mouth one more time. Okay. All right. The mucosa is intact. There are no drainage, no redness found. All right. So moving forward, I am going to palpate for your peripheral pulses. Okay. Can I see your hand, please? All right. So I am going to check for your circulation. Okay. The capillary refills are returned in less than 10 seconds. All right, and the pulses, radial pulses are intact. Bilateral pulses. Bilateral pulses are intact. And for the carotid pulses, one at a time, to check for the carotid pulses. The carotid pulses are intact. I am going to check for your heart sounds. Okay. So I'm going to listen to your heart sounds. I'll put this in. The lung sounds, the heart sounds are intact. S1 and S2 head, there are no S3 or S4 head. All sounds are intact bilaterally. The next thing, we are going to listen to your lung sounds on the back. Take a deep breath for me. Okay, I'm gonna have you say E. Say ah. All right, thank you. So the lung sounds are intact. No abnormalities noted. The next thing, I am going to check for the point of maximal impulse. The point of maximal impulse is felt at the 5th intercostal space, mid-clavicular line. And I'm going to check right here. Over here. Thank you. Okay, perfect. The point of maximal impulse is intact. The next thing I'm going to do, I'm going to have you lay down, please.
Okay.
Okay. So just okay. So I am going to palpate the abdomen, starting from the right, going up, palpating for tenderness, and I am going to auscultate for bowel sounds. All right, the bowel sounds are active. There are no tenderness noted. Could you please stand? Okay, so I am going to have you take it one step, few steps up to the front and back.
Okay.
Okay, and come back.
Turn around or?
Yes, please.
Okay.
Yeah. Okay. Okay, have a seat, please. All right. So the gait is intact. There are no vertigo, no dizziness noted. All right. The next thing we are going to do is we are going to have you do a range of motion. So I'm gonna have you lift your hand up and down and up and down. Okay, so I'm gonna lift your hand up. I'm gonna have you push my hand out, okay, and try to resist. Okay, thank you. And for the legs, I'm going to have you lift one leg up and down, and the other leg up and down. Perfect. All right, range of motion is intact in all extremities. All right. So the next thing we will do, we are going to check for neurological status, and I'm going to have you tell me what today's date is.
February 5th, 2023.
Thank you. And who is the President of the United States?
Joe Biden.
Perfect. Okay, so so those are the basic things we need to do. So any questions? Do you have any questions for me?
No.
Okay.
Not right now.
All right. So since you had a complaint about your hip, I am going to go ahead and do a brief focus assessment on your back. Okay. So I'm going to have you sit up a little bit. Yes, that's fine. So I am going to check for the costovertebral angles on your back. Okay, I'm gonna have you tell me if you feel any pain.
Okay.
Do you feel any pain?
No.
Okay, perfect. All right. So one more thing we are going to do. I'm gonna also have you lay back on the back. Yeah. All right. I'm sorry.
You're
Okay. So I am assessing for any bruises or any tenderness or any changes on the abdomen. None is found. So I am going to also auscultate for the unequal arteries on the stomach. Tell me if you feel any pain. Do you feel any pain?
No.
Okay, perfect. Then I am going to check for the head of the aorta, the width of the aorta. So I am going to put my hand over here. Tell me if you feel any pain.
No.
Do you feel any pain?
No.
So I am going to do a light palpation. And I'm going to do a deep palpation. Do you feel any pain?
No.
All right. Okay. So there are no pain on the abdominal area. All the four quadrants have their bowel sounds intact. Please stand up. You can sit, please.
Okay.
Okay. Thank you. So that will conclude our assessment today. We will go ahead and run some tests, and my assistant will help you with the checkup process. All right?
Okay.
Okay. Thank you very much for coming.
All right. Thank you.
All right.